So I was a co-chair with a couple of colleagues of mine, Mr. John Edwards, a surgeon, and Leah Taylor, a nurse specialist. And we essentially had two key speakers. The first speaker was Professor Eric Lim from the Brompton Hospital, who's the chief investigator of the MARS-2 trial. And Professor Lim gave an overview of the trial results, the implications of what those results are from a UK perspective and an international perspective. This trial was presented at the World Lung Cancer Conference last year in Singapore and essentially showed that interventional surgery in a randomized context was associated with inferior survival. And it's caused a lot of consternation in terms of a significant but small subgroup of surgeons feeling that surgery is justifiable even despite these results. I think Professor Lim today really addressed every single criticism that's been raised about this trial, and I think very robustly defended the data. And what was really interesting during the question and answer session was a sea of opinion from the audience, who really represent the entire UK thoracic oncology MDT, both clinicians and nurses and specialist nurses. And you could clearly see that they really felt this kind of surgery needed to stop in the UK. It was totally unjustifiable given the strength of the MARS-2 trial. So that was the first study, and the second study was a radiotherapy study. So we know mesothelioma is a very radiosensitive disease, even though the textbook suggests it isn't. We know that palliative radiotherapy is used for symptom control. Professor Hiley, I beg your pardon, Associate Professor Hiley, who's a consultant oncologist at UCL, really outlined the role of proton therapy in the potential management of mesothelioma patients, and then introduced us to a trial that has recently opened in the UK called the HIT-MESO trial. So this is a really, really exciting trial looking at randomizing patients to ablative doses of proton therapy planned to treat the entire measurable disease volume in a patient with a randomization to no radiotherapy, powered for overall survival. So it's a very complex study. The planning is very complex. There are two proton machines used in the NHS in the UK, one at UCL and one at the Christie in Manchester. And so this is a sort of really interesting, really complex, but I think ultimately will be a very fruitful trial, because I'm very confident that patients will go into it and will have the treatment, get randomized, and I think we'll recruit well. Now the trial's only just opened, it's really new, and we'll just have to see how it goes, but it's going to run for the next 2 or 3 years, I would have thought.